In February 2023, President Biden delivered disturbing news while at the State of the Union gathering.
Fentanyl is killing more than 70,000 Americans a year.
Fentanyl, a synthetic opioid that is approved for treating severe pain, is now responsible for taking countless lives.
In 2021, over 100,000 Americans died from drug overdoses. The drug behind 2/3 of those deaths, fentanyl.
Overall drug overdose deaths between 2019 and 2022 peaked at more than 106,000. According to reports towards the end of 2021, deaths involving synthetic opioids other than primarily fentanyl continued to rise with more than 70,600. In every 10 preventable opioid overdose deaths, at least 7 are male victims. Almost 50,000 men lost their lives to the drug in 2020, compared to a little over 18,000 female deaths that same year. Fentanyl is up to 50 times stronger than heroin and 100 times stronger than morphine, which makes it extremely dangerous and a major contributor to both fatal and non-fatal overdoses in the United States. Just like many other opioid analgesics, fentanyl also produces dreadful effects such as respiratory depression, pupillary constriction, urinary retention, euphoria, relaxation, pain relief, sedation, confusion, dizziness, drowsiness, nausea, and vomiting. Because of its massive power, fentanyl sparked a widespread epidemic in North America around 2013. And now let's understand this problem in detail when Asinga Unfolds. The opioid crisis as we know it today started in the 1990s when a powerful drug known as OxyContin, promoted and produced by one of the biggest pharmaceutical giants, Big Pharma, triggered the first wave of deaths linked to legal use of prescription opioids. As a pain reliever, the United States Food and Drug Administration approved OxyContin for chronic or long-term pain, basing on the drug's original label, which stated that iatrogenic addiction was almost impossible, but only if the opioids were legitimately used in the management of pain. At the time of approval, the FDA believed that the controlled release formulations of OxyContin would result in less abuse potentiality, since the drug would be absorbed slowly and therefore would not be an immediate rush to promote misuse. That, however, was far from being true because the organization's anticipation turned out to be false. It is still in question whether the FDA only underrated the drug or if it was corrupted to approve OxyContin that later became lethal, claiming hundreds of thousands of lives. OxyContin was extremely addictive. The drug binds to the user's opioid receptors and blocks pain signals, and that is the reason as to why this drug is used as a painkiller. While it is so effective at treating pain, the drug also makes the user feel a stronger sense of euphoria, making it incredibly addicting, even for those without a history of substance abuse. In the description below, I'll link a video that is only about OxyContin, so make sure to watch it after this one. Without a doubt, OxyContin was the biggest player in the first opioid epidemic wave, which began with the increased prescribing of opioids in the 1990s, with overdose deaths involving prescription opioids increasing since at least 1999. Apart from prescription opioids, there has been 2 more waves of opioid epidemics. That is to say, synthetic opioids and heroin. Heroin dominated the second wave that peaked in 2010 with a rapid increase in overdose deaths. One main factor that contributes to the popularity of this drug is availability, which means reducing exposure would result into prevention. Unfortunately, heroin use is driven by its affordable costs and extreme availability. Drug overdose deaths involving heroin rose from almost 2,000 to more than 15,000 between 1999 and 2016. But the number of heroin-related cases is now said to have trended down, with over 13,000 deaths in 2020 and about 10,000 deaths reported in 2021. The third wave of the epidemic began in 2013 as an increase in deaths related to synthetic opioids like fentanyl. The sharpest rise in drug-related deaths occurred in 2016, with over 20,000 deaths from this drug and others related to it. It would seem like the opioid crisis started off as doctors found themselves on a quest to find help for patients with long-term unpreventable pain safe from accidents or diseases such as cancer. Think about the hospice care, a program that is designed to make the process of dying as comfortable as possible for patients with chronic pain and untreatable conditions. The hospice sector started as a movement in the late 1900s to find better suitable ways and analgesics in providing specialized care for dying patients, linking pain and symptom control with compassionate care along painkillers such as morphine, heroin, and others. Since the amount of pain differs from one patient to another, the patient's initial painkiller prescribed may become less effective as the disease advances, which results in switching to stronger prescription drugs. Pharmaceutical fentanyl was developed for pain management and treatments of cancer patients, but since it has powerful opioid properties, the drug is often diverted for abuse. We know that every drug has had someone behind it or an organization. So, who made fentanyl? Paul Adrian Janssen, a Belgian chemist and a pharmacologist who spent several years working on new painkillers during the 1950s. With a loan of 50,000 Belgian francs received from his father, Janssen founded his own research laboratory in 1953 that later became to be known as Janssen Pharmaceuticals, and now owned by Johnson & Johnson. That same year, he discovered ambriostamide, an antispasmodic known to be particularly effective for the relief of menstrual pain. In 1958, he developed another drug commonly sold as Haldol, a major breakthrough in treatment of a mental disorder characterized by continuous or relapsing episodes of psychosis called schizophrenia. In the following months, while working with his team, he developed the fentanyl family of drugs and a number of anesthetic agents. In 1959, Janssen synthesized the potent opioid fentanyl based on SARS studies of meperidine, and later in the 1970s, he would improve upon the potency of fentanyl with the synthesis of carfentanil, a synthetic opioid that is 10,000 times more potent than morphine, 100 times more potent than fentanyl alone, and 50 times more potent than heroin. It is clear that opioid drugs are made with an intention of helping. But over and over again, we have seen these drugs cause epidemics and then fatalities. In many cases, however, it has been determined that manufacturers are intentionally making opioid epidemics possible in order to profit off innocent lives. Take the Sackler family case, for example, or a recent Teva lawsuit where the drug manufacturer giant agreed to pay more than $4 billion in several settlements. For more people, factors contributing to opioid addiction may include misuse, current or past substance abuse, untreated psychiatric disorders, peer pressure mostly amongst young people, including social or family environments that oftentimes encourage drug use and misuse. With all these head-on factors, how does one best avoid becoming a victim of the opioid crisis? I would suggest limiting inappropriate use of prescription opioids by avoiding opioid intakes that are greater in amounts or more often than prescribed. Second, patients and users in general should reduce the flow of illicit opioids. Think of participating in prescription drug monitoring programs, for example, or considering state prescription drug laws. Patients may have a chance of evading fatalities if they always inform their doctors about any side effects or concerns that they may have about using opioids. Speaking about working closely with your doctor, drug users should also try so much to abide to their doctor's orders. For example, avoid taking opioids with alcohol and other substances or medications as recommended by doctors. Now this goes to the families and friends of the victims. Do not neglect people who need help. Instead, help them seek treatment for opioid misuse. Check on them and encourage them. And last but not least, deploy harm reduction tools that blunt the risks of death, illness, or injury. Governments should definitely do more to curb and eliminate this problem, from reconsidering drug licenses and patents to regulating drug flows, availability, and accessibility. But before you count on governments, please count yourself first, because this is your life and we all have one. Don't forget to watch this next video that is about another lethal drug. Share, subscribe, and comment, but most importantly, please take good care of your life. I will see you again soon. Thank you for watching.